In the last decade, both young and mature athletes have significantly increased their levels of competition. This has resulted in a dramatic increase in both the number and the complexity of injuries treated by sports medicine physicians, especially concussions. With a long-standing history focused on rehabilitation, St. Charles Hospital covers all aspects of sports medicine and concussion management to keep these athletes functioning at their highest levels. That's what we'll be discussing today. So stay tuned for today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, thanks so much for joining us. I'm Jane Hansen. The sports medicine program within St. Charles Hospital's award-winning orthopedics department provides student athletes, weekend warriors, and professional athletes an unparalleled continuum of care from prevention techniques to injuries sustained during play. Joining me today from St. Charles Hospital is Dr. Haley Cuellar, a primary care sports medicine physician and the co-director of the hospital's ThinkSMART concussion management program. Welcome.
Thank you for having me.
It's good to have you here. It's so interesting for me to know that you yourself had a concussion as a student athlete many years ago, and here you are helping other people with this.
Yes.
Is that kind of a way that somehow this all attention and your focus started?
Actually, back then I didn't have any inclination that I was going to be so involved in concussion management. I was definitely interested in sports, and I knew I wanted to be a physician. And as I went through medical school in my training, I saw that this was an opportunity. And I did specific training and fellowship in sports medicine and found a little niche in concussion management and took that forward.
And there you are. So talk to me a little bit about sports these days and how St. Charles gets involved with it all. I know you've got this ThinkSMART program. I want to know what it is.
Sure. So in 2009, when I came to Long Island in practice, we saw that there was a need for concussion management. It was not very tightly regulated, and we didn't have a lot of protocols to make sure that the kids were being treated appropriately and brought back to the field in a safe manner. So we started the program very loosely tied with St. Charles. I was in private practice at that time, and we sort of went out to a few different high school districts in our community and started to talk to them and educate the families and the athletes and the coaches about concussion management. And from there, we sort of built this program, which follows very tight regulations to make sure that the athletes are appropriately recognized, treated, educated, and brought back to the field in a safe manner. Currently, St. Charles is running the ThinkSMART concussion management program with over 40 school districts in Suffolk County, a few districts in Nassau County, and it's really grown in a nice manner.
Well, there's been a lot of attention focused on concussions, particularly when we talk about the NFL and
Sure.
Professional football players. But it's not just football athletes, players that get concussions.
Sure. So we certainly see a lot of football players. I guess the CDC says about 63% of concussions are in football players. However, every sport, I've seen essentially every sport at this point. There's a high number in cheerleaders, soccer.
Cheerleaders?
Sure.
Oh, I never thought about that. Soccer?
Soccer, lacrosse in this area is quite big. Field hockey, ice hockey. I've seen swimmers with concussions.
I've never heard of that before, but that's
Sure.
amazing.
Yeah.
So when you say a safe manner, get them back to the field in a safe manner or get them treated in a safe manner, I'm assuming you're going out to these schools or somebody within the practice and the program is to talk to them about what to do before it all begins, before it all happens.
Sure. So before the seasons, generally there's an education program. So either the school district will run with our recommendations, run a program to discuss what is a concussion, how do you recognize a concussion, and what should you do if you're a parent or an athlete with a concussion. We give lectures all the time to coaches, athletes, to parents, and we explain to them what to do. And it's really, over the last 7 years, has really grown as far as the understanding and the concern in the community, and we've been able to make sure that everybody understands what's the next step. We really started out with a lot of people looking at it and not understanding or not knowing when a concussion was occurring, and now it's almost to the other end where we see a lot of kids in the office that are worried that they might have had a concussion, and that's a good thing to have. I'd much rather see that kid than miss the other kids that we were missing in the past.
So what are the symptoms?
So the most common symptom is certainly headache. About 73% of concussions will come in with a presentation of headache, but there's dizziness, nausea, sometimes vomiting, increased or decreased sleep, kids with visual abnormalities, difficulty focusing and concentrating in school. Generally, those are the things that we see.
Does it happen right at the moment of contact or the moment that the concussion occurs, or what's the period of time where the symptoms can still show up?
So most kids will have some symptoms at the initial contact. However, I have seen kids develop symptoms over the first 3 days. So if somebody has an injury that is suspicious for an injury that can cause a concussion, oftentimes I will have kids wait up to 3 days before they return to sport, and if they don't develop within 72 hours, generally they won't. Although there's always outliers. I've seen kids present a week after their injury and claim they had no symptoms until a week later. But generally, they will have some symptoms. The symptoms generally will change over the first couple of days and then will either plateau or decrease from there.
And how do you treat it?
So the first line of treatment is get them off the field. If you do nothing else and you prevent them from having another injury, you're doing the best thing for them. So you get them off the field and make sure that they're in a safe place, make sure somebody is watching them, that things don't go downhill from their initial presentation. And then usually I like to see them back in the office. So after they've had an injury on the field, either their athletic trainer or their coach should send them to have a formal evaluation in the first maybe 48 to 72 hours. And there's plenty of treatment. A lot of people think of concussion as go ahead and put the kid in cocoon therapy, make sure that they don't do anything, sit in a quiet, dark room. But we do introduce fairly early vitamin supplementation, visual exercises, balance exercises, certainly rest from physical and physical and cognitive activities. So we try to decrease the use of electronics. We try to decrease the amount.
Good luck with that.
Right, that's a difficult one. We try to decrease the use of TV and school. Certainly, we make very significant accommodations in school because today, you go to school and there's smart boards everywhere and they're using Chromebooks. So we try to pull away from those types of activities in school, as well as testing and the stresses that kids go through. Stress is one of the big things that actually increases concussion symptoms and actually can prolong the symptoms from concussion. So if we can take away some of that stress, we can take away a lot of their symptoms.
Wow, so you mean do they get stressed because they think they have a concussion, or they're stressed because they can't play, or stressed because of the treatment? Is that what it's from? Or
a lot of kids are stressed because we're taking them out of things that they're so accustomed to doing. So if we're taking them away from taking tests and they miss 3 tests in a week, they're nervous that they're going to have an adverse result in their academics. Generally, all the school districts that we work with are very accommodating. So if somebody misses a whole lot of time in school, oftentimes we can get that forgiven for a medical. But kids tend to be very nervous that they're the only ones. So maybe they're going to get, this is going to be taken out on them in a harsh manner. So we try to take that stress out of the equation.
You said something about vitamin supplements. What's that?
So we use omega-3 supplementation, which has been used.
It's like fish oil, right?
Fish oil, sure. It's been used for many different things, but it does help with brain healing. We use magnesium oxide and riboflavin, sometimes for headache management, which has been used in the migraine literature. So those are the things that I'll start on an initial presentation if they have a headache predominance. I always start kids on omega. I give omega to my children. I think it's important for multiple things, including musculoskeletal problems, brain maturation, etc.
And it's also supposed to be good for halting the dementia process too. So that's what I've been told.
Sure.
Anyway. Stick around, because we're going to keep talking about this, and we're going to meet a family who has a relationship with the doctor that spans generations. We'll be right back. Welcome back to CHS Presents Lifestyles at the Heart of Health. St. Charles Hospital's sports medicine program in Suffolk County provides comprehensive care for both competitive and recreational athletes, from prevention programs to both non-operative and surgical treatments. In our last segment, we were chatting with Dr. Haley Cuellar from St. Charles Hospital's sports medicine and concussion management programs. We're going to continue our discussion in a minute. But first, let's meet a family of patients that depends on these programs to keep them healthy in all seasons.
I'm Wendy Mishnov. This is my son Nathaniel. He is the youngest of 3 children. I have a 23-year-old son, 20-year-old daughter, and the 20-year-old daughter is how we met Dr. Cuellar. Kayla was the concussion queen, had sustained the one, went into post-concussive syndrome, and I think that in part was because we didn't get her to Dr. Cuellar fast enough. You know, I never really knew the signs. You hear the signs, you make sure they don't fall asleep, and that's about it. Like, that's all I knew about concussions. So when she first hit her, I mean, she's a gymnast. She's banging stuff all the time. She's tough, so I didn't think too much about it. And then when it didn't go away, we had to think more about it. And I have learned so much about concussions from the expert. You know, Dr. Cuellar is an expert, and thank goodness, because boy, does it make a difference. So all of her recommendations really helped heal my daughter. Nathaniel likes to break his bones. So we've seen her quite frequently for Nathaniel, but of course, once he broke the first bone, there was no question about where we were going. We didn't have to think twice about it. We just knew we were going to Dr. Cuellar.
The first time I went to Dr. Cuellar, I was a little nervous because I never met her before and I didn't know what we were going to do. But the second time, I was perfectly fine. I like to do fencing, and I've not had any injuries while fencing, but I'd also like to do longboarding, but I broke my wrist doing that. I also like to play basketball at school during gym, and my friend threw me the ball and I jammed my finger and it broke. A buckle break, I think. And that happened 2 more times on 2 other fingers. And then my ankle, same ankle 6 times. She treats me very well, and she's very gentle. I'm all healed, and she's done very well.
After the first meeting with Dr. Cuellar and Kayla, anything that had even a vaguely orthopedic, hint, we were calling, we were going. So not a question. So when he continually broke his ankle and the finger and the wrist, at least I had the comfort of knowing that somebody who knew him, who knew how to handle him, and knew, was really truly professional, he would be in good care. So that took a lot of the stress off of having an injured child. So having brought both 2 out of 3 of my children to Dr. Cuellar, I got to know her very well, got to really trust her implicitly, so no problems there. So in between Nathaniel's visits for various bone breaks, I ended up with an issue and thought it was just, pulled muscle or who knows what it was, but it felt like something that should go to Dr. Cuellar, so we did. And it ended up being some torn rotator cuff, partially torn, little things like that. And she caught it, and then she also had the people at her fingertips who were able to get in there and repair it. So she's really a people person, and so she has that skill in addition to her medical training and her concussion expertise. So, and we're all very lucky to have her.
So obviously that family has a lot going on and sees you a lot. But it made me wonder, when she said Nathaniel likes to break his bones, does that mean that are there some kids or even adult athletes or non-athletes who you see with repeated injuries?
Yes, most certainly. It's either related to their level of play, either they're playing at a high level and they are at higher risk, or some kids are a little bit more clumsy than others. Other people are involved in repetitive activities and may have, a repetitive overuse injuries and more than one of them. So I certainly do tend to see people, and I see them again, and I generally will see their entire family. I like to make a nice rapport with my families, and
Sure.
and generally they will come back with their family members.
So what do you tell people who have some kind of repeated injuries? I mean, clearly you're not just dealing with concussions, you're dealing with all kinds of sports injuries in your program. But how do you get them to either maybe make some adjustments or think about maybe vitamin supplements or something that might help them so they don't have to go through the same thing?
So I definitely like to have people maintain some sort of core musculature program, so core stabilization program. I like them to keep up with a stretching routine. So once they're done with their injury that I'm seeing them for, I like them to maintain some sort of basis where they can hopefully prevent this from happening again. So oftentimes I'll be recommending a routine like daily or every few days stretching program, or light repetitive strengthening program that might keep them from having another injury in the upcoming future.
Do you think any of this has to do with overuse?
Most certainly. These days, kids who play sports tend to play the same sport 12 months out of the year, which in the past that hadn't been. We had kids who played 3 sports and they, did vary what they did throughout the year. Now that we have such focus on maintaining the same sport throughout the year, we have them doing the same thing over and over again, and oftentimes that will lead to a repetitive use injury. So I oftentimes will tell people to take a break from that sport, maybe cross-train, either do just a lifting program in their off-season, or maybe pick a different sport, something just for fun, so that they could be using different muscles and using different parts of their body to allow their main sport muscles to be relaxing.
Take a rest. How often do they want to do that, though?
Not very often. It's very difficult to, have a kid take a rest from their primary sport, but once you explain why, they generally are more willing to understand and to go ahead and follow those recommendations, because if they don't take that rest, they're at a much higher risk of A, injury, and B, they're going to burn out a lot faster than they would if they were to take that rest.
And it will add to the stress, which of course only emphasizes the injury.
Sure.
Lots of circular things going on there. All right, we're going to take a quick break here, but don't go anywhere because there's much more of CHS Presents Lifestyles at the Heart of Health right after this. Welcome back, everybody. And of course, today we're talking about sports medicine, and that's your specialty. So, a sports medicine physician, we haven't even talked about exactly what it is that you do.
Okay, so I practice non-operative sports medicine. There are 2 different types of sports medicine providers at St. Charles Orthopedics. We have non-operative providers and operative providers. In my case, I did a primary care residency, so I am trained in internal medicine and pediatrics, and board certified in both. And then I did a fellowship in what's called primary care sports medicine. So when it was all said and done, my specialty actually includes the ability to take care of primary problems, so hypertension, diabetes, that type of patient problem, as well as the sports medicine problem. In my practice today, I don't take care of any primary care problems. I only take care of sports medicine injuries. So I take care of orthopedic ailments in addition to concussions. And I treat non-athletes in addition to athletes. So I can treat any age group down to an infant all the way up to, the elderly population for whatever orthopedic ailment they have. Mm-hmm. In addition, I take a lot of time out of my day to go to different sporting events. So I cover football games in this season.
Wait, does that mean you have doctors on the sidelines, really?
Absolutely.
So then what happens? Just walk through this with me. If you see an injury or you see a concussion or something happening, you guys then will go on the field and check out the athlete?
So we're really lucky in Suffolk County that most school districts actually have an athletic trainer. So generally we work very closely with our athletic trainers. Each of the sports medicine providers in our group have different school districts that they take care of. And generally we let the athletic trainer triage and make sure that the athlete does or doesn't need a provider on site. But in any given football game, for sure, I probably step foot on the football field a few times whether it's a dislocated shoulder or elbow, or if it's a concussion. Very occasionally we'll have to do C-spine immobilization if that's, if it's a C-spine injury. So yeah, I spend a lot of Friday nights and Saturdays on the football field.
Oh, your family must love that. Or at least they can go to the game with you.
Sure.
But so, I mean, that's really hands-on care. And I know you kind of started this program in the schools by just going in and offering some baseline tests. So explain to me how that works.
Sure. So in concussion management, certainly the most important thing is education, so people know what they're looking for. But one of the things that we've been doing over the past decade in concussion management is really doing these neurocognitive testing, baseline testing, to make sure that we have a child's baseline or an athlete's baseline prior to the season so that we know kind of where they're starting from. So it started in 5 school districts where we went in and we tested the contact and collision sport athletes with a computer test called Impact. And we offered it to these 5 school districts, and from there it grew. Now there are other tests that are available, and we're actually piloting a program right now, which actually also includes not only the neurocognitive side of it, but in addition, some balance baseline testing as well as some visual baseline testing, which has been showing us some pretty interesting results.
Like?
So when a child comes in, like I said before, oftentimes they will have some balance abnormalities or visual abnormalities that in the past it was fine for us to evaluate and suggest that that was an issue, but we didn't really have any baseline information to tell us that that was or was not how the athlete was prior to their injury. And now if we have that baseline information, we can really give them objective information to explain to them that this is where your default, these are where your defects are, and this is what we need to work towards to make sure that your concussion has improved.
Boy, it'd be great to have that for mature athletes who are not in necessarily a competitive sport, but they're equally as competitive in whatever they're doing. They're biking, they're running, they're all of that stuff. They're playing basketball at 55 or 60, and things can happen. Right. So do you see a lot more older adult injuries now because they're continuing to be very competitive in the sports field?
People tend to stay active longer, and we most certainly see a lot of overuse injuries, sometimes acute traumas, but mostly overuse injuries in the older athlete or the weekend warrior. Certainly in my practice, since I've been in practice, it has been a common theme for people to stay active. And it's great to see. It's wonderful when somebody comes in and they tell me that they were, a 60-year-old still playing tennis. It's wonderful because, we're keeping them active, keeping people, fit as far as cardiovascular health and that sort of thing.
Do you suggest anything to them that they can do, i.e. vitamin supplements, i.e. like stretching exercise? I mean, what do you tell them versus, the young athlete?
I think it really carries over that, the older athletes, certainly I think vitamins and mineral supplementation as well as good nutrition is important, and I think that goes right throughout, all ages. But again, the stretching is super important for the older athlete. Taking more time for the before and the after activity stretching routine is important so that they're not jumping right onto the tennis court or the basketball court without appropriately warming up. In addition, making sure that they have the appropriate time afterwards. So maybe it's not appropriate for a 60-year-old to be on the basketball court every day. Maybe they need a day off.
Rest, just like you suggested for the young athletes. Yes. And what about things like massages or hot, baths or things like that? I mean, are those things recommended too? Do they help?
I find a lot of athletes enjoy that, and they do find that it helps, and I encourage whatever works for them to keep them from repeating injury or overuse. I have a lot of people who do go for sports massage, a fair number of people who go through acupuncture treatment to keep themselves in a healthy manner. So, whatever really works for them, if they find something that works, I think is really important to keep doing it and really taking the time for themselves and not just saying, oh, well, I'll just deal with this later. You really have to, if you're going to keep an active lifestyle, you have to make sure that you have everything that goes around it, the appropriate nutrition, the appropriate hydration, the appropriate stretching, the appropriate rest.
And you continue to be an athlete, right?
I do.
And are you taking your own advice?
I do. I take the time for myself. I
don't know how you have it, but
I have a very busy lifestyle. I have 4 young kids, but I make sure I get to the gym 4 to 5 days out of the week. I'm keeping my hydration up. I follow a very regimented diet, and I definitely take my rest days when I need them.
Very good. Well, thank you so much for sharing your story with us and telling us about the great work you do at St. Charles. It was a pleasure to meet you, Dr. Cuellar.
Thank you.
For more information or to schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, you can call 1-855-CHS-4500 or visit chsli.org. Thanks so much for joining us. I'm Jane Hansen, wishing you goodbye and good health.